have a breast cancer patient, and once I saw how people who didn't have the health care that I was privileged enough to have were treated and how afraid they were to even leave their job for one day, afraid they were going to lose their health care. It changed my whole life when I started fighting for single payer and Medicare for all. And people get it once someone in their family gets sick. You don't have to wait till that happens.
Hello, my name is Ryan Oates. Welcome to the Progressive Mass series about our policy agenda for the 2025-2026 legislative session. I'm here today with Kimberley Connors, the Executive Director of the Massachusetts Campaign for Single Payer Healthcare, or MassCare. Kimberley, thank you for joining me today.
You're welcome. Thank you for inviting me, Ryan.
Yeah. So we're here to talk about a bill in the Massachusetts Statehouse, an act establishing Medicare for all in Massachusetts. Before we get into the details, I wanted to start by defining the problems that it aims to solve. So, as you understand it, what are the fundamental problems with the American healthcare system?
The healthcare delivery system that we have is based on the economic idea that healthcare is a marketplace. Getting your medicine, no matter how you get it, is done through a marketplace system that builds profits into the system. I think that's the problem. We can start there. That is the problem that I see every day. Instead of considering healthcare a human right, as almost every other nation in the world and all of the G20 except for us do. Instead, we have a system that is cumbersome, complicated, and discourages people from actually getting health care.
You've got essentially a system that is set up not to make people healthy, but to make money, right? So insurance companies are all corporations. Primary goal of a corporation is to make money for shareholders, right?
Even our non-profit hospitals in Massachusetts still build profits into the health care equation that ends up being a copay or co-insurance for you.
You've got that nonprofit element. You've got the insurance companies who are, because their main goal is to make money, a lot of the time they'll find ways to prevent you from getting care. You know, like denials, the United Healthcare I just saw in the Boston Globe denial rate was like 32%, something crazy high like that. Okay. So we've kind of defined what we see as the main problem. Let's turn our attention to the bill. So it's an act establishing Medicare for all in Massachusetts. The lead sponsor in the Senate is Senator Jamie Eldridge. The lead sponsors in the House are Lindsay Sapadosa and Margaret Scarsdale. So the core of the bill is that it would establish a single payer system. We currently have a multi-payer system. I'm wondering, could you kind of outline the difference between those two and why a single payer system would be more effective?
I think the easiest way to do that is for folks to understand that there are over 1,400 insurance plans in only Massachusetts alone. That means every single person, whether it's like, say, you work for Verizon, Verizon is self-insured. That means they can tweak a plan and call it their own. They can deny certain things, get certain things, and build the plan for the corporate standards, not for the healthcare and patient standards. Our bill, the Act to establish Medicare for all in Massachusetts, which now has its numbers. It is S860 in the Senate and H1405 in the House, would establish the Massachusetts Healthcare Trust. This would be the only health insurance in Massachusetts except for Medicare. It would get rid of those 1,400 different possible payers and have only one. The bill is very detailed into the specifics of how it would run. A bill is based on what was then the Saskatchewan Healthcare Trust, which they did 30 years ago. For 30 years, we have been submitting this bill, and Canada did it one province at a time. We believe Massachusetts can be the leader in doing as we move towards one state at a time to Medicare for all.
And since you bring up Canada and their
Mm,
system, a lot of the data I've seen has shown that Canada spends half as much on administrative costs as we do. And you were mentioning how the single payer system is a lot simpler, right? You have
mm,
one payer, so hospitals and people providing the care don't have to manage, like as you said, 1,400 different payers with different pay scales that charge different amounts. That's like a lot of extra administrative tasks that they then have to do, right? So is that kind of one of the aims of this bill?
That is, that is definitely one of the solutions that this bill would bring to the current healthcare dilemma we have. We're in a crisis in Massachusetts. We have lost, last year we lost four hospitals, the three that everybody knows about, but that was also, there was Children's Floating Hospital was lost as well. And the single payer system would alleviate the need for 484 billers at just Mass General on Fruit Street, because there'd be one form where the bill would establish a budgeting system, just like your fire department has a budget, the hospital would have a budget, and they live within their budget. There's no upcoding to make the visit more expensive as is currently happening, especially with people that have Medicare Advantage program plans. I often equate the way it will run to the Paid Family Medical Leave Act that has been law in Massachusetts. I worked on that. I was a part of the Progressive Mass Raise Act, a team that helped get that through a compromise bill in the House and in the legislature. But it has trust. People pay into the trust. They pay through payroll taxes. They pay through, if you're self-employed, you would pay as well. And then everyone, the first 20,000 is exempt for like capital gains and things like that. The money in the trust builds up and it gets paid out, and it gets built up and it gets paid out. Since it would be open to all Massachusetts residents, it would work just like our current does. If you go out of state, the other state would bill to the Massachusetts Healthcare Trust. The reason paid family medical leave is never heard of, it's working. It works well, it works quietly, and that's kind of what will happen in healthcare. Things would calm down. My predecessor is now in Denmark, and she went there specifically to get maternity care through a single payer system. And when asked, she says, it's just calm, no rush, no one's freaking out. Whereas our current healthcare system is in crisis from top to bottom. Everyone in it is frantic and panicked.
One of the big things people talk about when comparing single payer and multi-payer systems, comparing to Canada, for example, people save a lot of money in Canada, right? Like, could you compare the amount that like an individual person would spend on healthcare compared to the US system now?
In Canada, they spend I can't speak to exactly how much they spend individually. I can speak to how much they save, though, as individual trusts. What was about on par on with us, about 40 to 50% of every dollar being spent on healthcare going to administrative costs. And, from the CEO that makes 1.3 million, and that's at a very small hospital. The big hospitals make a lot more than that in Massachusetts, all the way down to the proverbial bandage for $300. The system itself saves over 50% of what it used to spend. And our projections through our economists is that we in Massachusetts would save over 30% as well as what we're currently spending. And some people say, well, why isn't it more? One, we want to be, conservative with our figures, but on top of that, we're thinking about billions of dollars. 30% of the 48 billion that they were currently spending in Massachusetts, that's a lot of money.
So we talked about cost. The next part
Mm,
was universal access. So could you talk
yeah.
about, like, right now, I know it's about 2.3% of people in Massachusetts are uninsured. Compared to the national rate, that's pretty good. And national rate's like 8%, but it's still 2.3% of people. So how would this bill help to make everyone have access to healthcare?
It's an excellent question, Ryan. You see, because that is our insurance rate, insured rate, not how many people have access to health. I believe because we have a penalty. If you don't carry health care, people carry at least something so they don't get a penalty on their taxes. But it belies the fact that these are high deductible plans that people are unable to afford the deductions, that they don't offer a complete services healthcare system like we would with our bill, everything from birth to death, including your teeth, eyes, and ears, which would be novel. And we like to say, look at that rate, it's so great. It does not guarantee access. The Stewart fiasco that happened last year left communities that were already vulnerable. Dorchester, the largest Black and brown populations in the city, live there. They don't have a hospital now. They have to get in an ambulance on the Southeast Expressway and pray they can make it downtown. They had, because Stewart had closed Quincy, which was the other closed hospital, 10 years before, and sold that for condos. The other healthcare desert that Stewart created, which is in north central Massachusetts, the Route 2 corridor, 17 communities that were dependent on the Neshoba Valley Medical Center, they no longer have a hospital either. And in every single fire department is in total distress, trying to send people. A lot of them go to Lowell, as a matter of fact, because the wait times in Worcester are too high.
People that are in an ambulance that now it takes, say 40 minutes or an hour to get to another hospital. The reality is for someone maybe with a heart attack, with a, serious, injuries from a car accident, those people are more likely to die.
By treating healthcare as a commodity, not as a human right, we're seeing in places where there's less wealth, hospitals are closing down because people aren't able to afford and access the healthcare. Is that kind of what you're saying?
That is indeed what I'm saying.
So this system, it sounds like, as a single payer healthcare system, would make healthcare more accessible. More people would be able to access it. It would make things less expensive, so that the average family would be spending less on healthcare, and it's just simpler, much simpler for everyone involved. If people are interested in helping to make this a reality, what can people do to support this bill?
There are quite a few things. You can go to masscare.org and you can sign up. You'll get notifications. You can read about the bill. We have a little video that you can see about how we've structured the bill in the Massachusetts Healthcare Trust. You can reach out to your legislator, telling them, I support the Medicare for All Act. Do you? We're in a co-sponsoring period right now. And the other thing you can do, you can talk to your municipality, because we have a calculator on our website that shows municipalities how much they would save if we had a single payer system in place in Massachusetts.
Municipalities are able to pass a resolution in support of Medicare for all, right?
They are indeed. They are indeed.
Yeah. Have you had a few that have done that?
We have a list. Yes, we have a lot on the Cape and in Western Massachusetts. Boston has. We continue to chip at it one at a time. I'll get back to that. I'll get back to the resolutions after Lobby Day.
Yeah.
But we also do forums all over the state.
And you mentioned that it is co-sponsor season. So
Yes,
we have the Progressive Mass scorecard, which has been updated with which representatives and senators have co-sponsored. So I'll put the link to that in the description for this video so you can check if your senator or House rep have co-sponsored. And if not, call them to do that. Okay, so beyond that first step, once people take that first step, where can they go to follow along with this bill? You said your website. Could you say the name of the website again?
masscare.org. You can sign up. We send out email blasts periodically. And if you want to, you can email me individually at info@masscare.org or director@masscare.org. And we'll get you together with people in your area or people that are meeting statewide. We have a grassroots organizing committee that meets monthly and plan all kinds of strategies to talk about there's a better way. There's a different way and a better way.
As we come to a close, there's a quote that I wanted to end on from Martin Luther King, that the arc of the moral universe is long, but it bends toward justice. And I think what a lot of people don't realize or don't think about as much is that it doesn't bend that way on its own, and that we have to bend it. So I want to thank you for, recognizing these things and using your time to bend the arc of the moral universe toward justice. So thank you so much.
Oh my goodness. You're more than welcome, and to even be mentioned in the same breath. This is humbling and honoring for me. Um, MLK's other quote is, of all of the injustices, healthcare is the most perverse. Yes. Thank you for all you're doing, Ryan, as well, to help people to understand that there is another way other than just agonizing over what's happening right now.
Yeah. All right. Well, I think we'll end it there. Thank you so much.
All right. You're more than welcome.